Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and I'm one of the specialists here. And today we're going to talk about failed surgeries, okay? So regardless, I know you're probably wondering, I can't believe my surgeries failed, all this stuff. Hang in there. There's still hope. We've seen plenty of cases that have failed surgeries and they still have pain or they have a new pain after surgery. We believe that there's always a root cause to why you have your pain. You just have to find the right specialist to be able to solve this. So I know it's frustrating that you're dealing with this, but hang in there. We have seen plenty of cases that failed surgery and still get a good outcome and get back to doing everything that they want to do. So there's three main reasons of why you could have had these increased symptoms or worse symptoms or the same symptoms after having surgery. One is obvious. There could be a surgical failure, or the prosthesis didn't work out, or the surgery was done wrong, or there's a loose screw. That's reality. There could be some error with the actual surgery. For example, we've seen a case, someone got a total hip replacement, had a horrible outcome with it. They came to see us. I felt there was something wrong with the prosthesis. I was like, something is just not right. It shouldn't be like this. I felt there was something wrong with the total hip prosthesis. Referred them out to a specialist. They verified that the capsule or the new acetabulum was actually off and loose, and there was a hip problem because of the surgery. Went in for a revision, came back out, 100% good to go after rehab. So that's a perfect example of, yes, there is a case where there could be a surgical error. The second thing is possibly you could have had surgery on, the surgery is a success, but they did the wrong segment or the wrong area. They didn't go after the root cause. They chased a false positive finding on an MRI or an X-ray. That does happen too, okay? The surgery was done right. It's a successful surgery. It just missed the root cause. And they were chasing the effect and not the root cause. Now, this doesn't happen more on extremities. This is more on the spine because, the success rate of fusions is like 50 to 60%. And the reason is because they chase after a false positive finding. There's an excellent testimonial below. Evelyn's story is a perfect case of this, where she had chronic neck pain with a radiculopathy going down her arm. She had a cervical fusion, no change in symptoms. Suffered for 10 years, went on pain meds, gabapentin, all this stuff. Ended up getting another cervical fusion above the next level. Still had the same symptoms going down. I treated her for thoracic outlet. I got rid of the arm pain and we weaned her off of the meds and now she's doing great. So again, they went after the spine when it was really a thoracic outlet problem. Perfect example where you missed the root cause, okay? The third one is the surgery was a success, but you have these underlying risk factors or impairments that build up for years leading up to the surgery that are not being treated properly. So the surgery solved the problem and it fixed the root cause, but no one addressed these underlying risk factors. And this could have been poor treatment because your therapist or the chiropractor or whoever's doing the treatment after surgery, they missed these things. And that's why your symptoms are starting to come back, or they're not fully resolving, or you may have new ones. Because just think about it. For years, you've been dealing with this problem. Your body compensates and develops these impairments and compensates for that pain. You kind of get in there. It's not as simple as like you lift the car up, take out the bad tires, put on new tires, and just go. It's not that simple. Your body compensated for years with this, and you have these underlying impairments that are still present. Thus, you're still having symptoms. So one of those three things are normally the reason why you didn't get the good result that you wanted after surgery. So if you're still struggling, if you haven't got answers or the root cause of why you're still struggling in pain, you can click on the links below or scroll down here and look at some of the patient testimonials. People who've came here who failed surgery, who solved the root cause and got a good result eventually. If you have any questions, you can visit our website at pursuittherapy.com or give us a call today at 407-494-8835. Thank you for tuning into this video. I hope you learned something, and I hope to hear from you.